So hi everybody, welcome to Porzio Planning Care Conversations with Crystal. I'm so excited to introduce everybody to Mia Kebea. She's with Seniors in Place and one of my absolute favorite people to talk to about long-term care for my client population. And so without further ado, this is Mia. Mia, tell us a little bit
Hi.
about yourself and Seniors in Place.
Oh, thank you so much, Crystal. Um, Seniors in Place is my family's company. I'm extremely proud of us and all that we've accomplished. We're a family company with my brother, my father, and myself. We opened our company in memory of my mom and my grandmother. My mom was diagnosed terminally ill when she was 43 years old, given 6 months to live, but she ended up living for 7 years. So unfortunately, we lost her when she was 50 years old. But in that time period, we learned so much about in and out of the hospital, going to rehab, in-home care, what it's like to take care of a loved one in their own place and in their own space. On top of that, my grandmother was also aging in place and terrified to pass away in a nursing home was her biggest fear. Um, and we went through probably 15 or 16 different caregivers prior to us finding her angel. Her name was Jacinta, and she put up with a lot in order to take care of my grandmother in her own home. And I don't know, she ended up staying as a long time. And my father was on call to my grandmother all the time. So between my mother passing and my grandmother passing and us learning this industry firsthand, we decided that we were going to open up Seniors in Place and we were going to do it better than anybody else. So I really appreciate you having me today. And it's really important that I'm able to share our story and what we've been able to accomplish.
Definitely. And I think that the biggest challenge, at least for our client population, is really maneuvering services and understanding how incredibly complicated the healthcare system is. It shouldn't be, but it is. But even with that complication, knowing that there are places and people to talk to and resources to tap into to make the process easier. So, my first question for you is, what would you say to someone who's considering home care? You know, maybe mom needs a little bit more help, dad is kind of frail, but things have not completely gone awry. What would you recommend that they do if they're first kind of thinking about home care?
I think that everybody that is looking into providing care for a loved one in the explanation or the situation that you just gave me, I think it's really do your homework. I think it's honestly, figure out, does the person want to stay in their own home? If so, it's very simple. It's kind of like, is home care the right choice for them? And by having conversations with home care agencies, I love having conversations with people, just so you know. I have conversations every day, all day long. Some people decide to go with it. Some people decide to think about it. Some people, assisted living is a better option or whatever. But you got to really kind of ascertain whether or not your loved one wants to remain in their own home, but is struggling really to live independently. And if that's the case, and they're having a hard time with the littlest things, the ADLs, the activities of daily living, then I think that the small tasks, which are like cooking and cleaning, laundry and linens, getting from a doctor's office, putting on their shoes, making sure that the food in the kitchen is not spoiled, those type of things. I think that it's a really good idea that you bring somebody in, even if it's on a part-time basis. It could be 4 hours a day, and it could be no 24 hours a day. I need 24 hours of care. My mom doesn't sleep at night. So it really has to be the right choice, and you should really talk to a few different agencies in order to decide which agency is right for your family. I'm always available to take the calls and make choices with you or with your clients. We take care of people from the beginning of their decision and the smallest of care all the way up to the end of life. So, it's really doing your homework and really feeling comfortable with the decisions that you're making.
Will you come out or someone at Seniors in Place come out to do an assessment to figure out if home care is even physically an option? Like, are there barriers in the home that would limit someone's ability to get care at home?
There's no barriers in the home. um, when it comes to home care. It just, the only barrier I could say would be even a barrier would be whether or not it's a live-in caregiver or it's an hourly person. If there's not enough room in a home for someone to live there, then obviously it's an hourly person. But we provide care in the smallest of spaces, like an assisted living room, one room, all the way up to giant homes and that type of thing. But to answer your question is, does somebody come out to do an assessment? Um, at this point with the COVID situation, I'm doing a lot of Zoom meetings where families are calling me on FaceTime and showing me the home. And it's actually been really awesome. It's an awesome experience.
Keep it after.
What's that?
Keep it after COVID,
Oh
right?
yeah,
All
you
this
know what?
technology,
I
we're going to keep using it.
totally. Yeah. So, I mean, at this moment, I'm not coming out to the home, but physically, but I am doing evaluations over Zoom, over FaceTime, one-on-one conversations. But once we decide that, yes, Seniors in Place is the right choice for a family, my nurse comes out with my caregiver once we decide that we're going to begin care. And my nurse will do an evaluation, um, and do an assessment and put a care plan in place and train the caregiver on how to care for that loved one individually. No care plan is the same. So just like no people are the same. So um, we are there on the forefront and the ability to assess the situation very simply. Most of the time it's by a conversation, just to figure out if the person is live-in, hourly, and what the actual needs are. And if a visual is needed, then we do a Zoom or a FaceTime right now. Once
Awesome.
COVID's over, I'm coming out. I can't wait.
Yeah.
I
Yeah,
cannot wait to get out of here.
we're all coming out of hiding once
I know.
once COVID is over.
I know. I
So
know.
one of the things that I hear a lot from clients, and sometimes they tiptoe around the issue because they think for some reason that their attorney is going to disclose information about them, which for
Mm,
everyone listening, we do not. Client confidentiality is a real thing, and we do not snitch on
100%.
our clients. Okay, but
100%.
oftentimes, one of the questions that will come up is, "Look, I need home care for mom. I need some assistance for dad. I'm thinking about, hiring Susie from down the street that someone referred me to.
Hmm.
You've referred me to a home health agency. What should I do?" I can talk about the legal aspect in a second, but Mia, from your standpoint, what are the benefits of hiring an agency?
Oh my God, it's such a good question. The benefits of hiring an agency. Um, there's so many actually, but I think that we'll start with just being, the family would be protected by insurance. The company is bonded, they're licensed. They have a team of people working behind them, behind the scenes at all times. Um, I can speak for myself with Seniors in Place. We have on-call 24-hour nursing. We have on-call 24-hour staffing, and we have on-call 24-hour case management, where the family would always have somebody on their, behind them to have their back if there's an emergency, and so on and so forth. Our caregivers are all certified home health aides that are board certified through the Board of Nursing in the state of New Jersey. They also have ongoing training in our education center. We have a state-of-the-art education center that is now plexiglass enclosures, but it is something that we take very seriously. So when looking for care and trying to find agencies versus private, I never would recommend hiring a private aid. It's just my personal preference. I've heard a lot of horror stories. I will not go into them with you. But having an accredited agency, in the state of New Jersey right now, it is not legal to operate as a home care agency if you're not accredited. And we happen to be accredited at the top 1% of all home care in the state at this point. So we doing things right. I think it's very important that you do your homework and you're comfortable with the people that you hire. But I also just, I can't drive it home hard enough that I think that having a true agency that's legal, that's doing things right, that's hiring the right aides is the most important thing.
For the folks out there, this is just kind of a little tip. So for the people out there who are receiving home care themselves or have set it up for their loved ones, and they don't have not hired an agency or don't have an agency relationship, the one thing to remember is that accidents happen. And what I mean by accidents, I don't mean mom falls or dad slips. I mean accidents of, oops, what was I thinking when I just did that? And
Mhm.
so I had a situation many years ago where a family hired a private caregiver who had been caring for the wife in that scenario. She was very young and had MS. And the caregiver was providing care for a little over a decade. And at that point, it was time for her to transition to an assisted living facility.
Mhm.
And unfortunately, she was, well, I should say, fortunately, she worked for a family that was going to pay her severance and was going to make sure that she had a transition period because she had been
Wow.
working with them for so long. But it was a one-to-one relationship of which there were no income tax reporting or filings that had transpired over those years. And so the oops or the mistake or the what was I thinking that I'm referring to is that when her severance period was over, she filed for unemployment. And unfortunately, when you file for unemployment, it's kind of saying to the government that you had a job.
Mhm.
It triggered a whole host of issues, of compliance issues, not just for the family who hired her, but also for herself because she had not reported that income at the right, at the right levels throughout that period of time. So I just say this kind of cautionary tale of be vigilant and let's not cut off our nose to spite our face. To the extent that we can set up even a one-to-one relationship where it's done with payroll taxes and with all of our kind of dotting I's and crossing T's, it's best to do that. The benefit from my perspective on this piece with hiring an agency is that you don't have to be the employer.
Mhm.
So you don't have to do the caregiver agreement. You don't have to set up payroll. You don't have to worry about making sure that the unemployment insurance is paid and the workers' comp insurance is paid every month. You hire Mia, and she takes care of that.
That's
For
right.
you know.
That's right. And they won't be stuck with the taxes at the end of the year. Where it's a lot to hire a caregiver. Also, one other thing I'll point out, just to feed off of what you're saying, is a certified home health aide. They have to be overseen by a nurse, and the nurse has to be under a company in order for them to keep their licensing. So they're not actually legally allowed to act as a certified home health aide with their CHHA license unless it's being overseen by an RN.
Oh,
So it's something you should just know.
that's
Just one
really good to know.
tidbit.
So one of the other benefits that we didn't mention, but Mia is going to jump into in a minute, is making sure that people who are in your house should be in your house. So there are these fancy things. I think they're fancy. Some people don't think they're fancy, called background checks. Where we make sure that the folks who you are welcoming into your home have not, I don't know, robbed a bank last week or had some type of incident that is not something you would want to welcome into your home, which are also requirements of employment, right, Mia?
Of course, of course, of course. 110,000%, yes. Um, so, picking up from that, yes, background checks are huge. And obviously we do them. We are the employer. I would say that the other things that are really important, Crystal, are the fact that somebody has a physical. They have to have physical by a doctor, and we have to have a copy of it that they're safe to go into someone's home. They have to have something called a PPD, which is what you call the tuberculosis test, and it has to be negative. Sometimes it has to be a two-step. So if they do come out like they have the tuberculosis, they then have to go follow up with a chest x-ray, and that has to come back clean from a doctor that says they are safe to work. Um, They also have to have what you call now a COVID test. And they're ongoing tests. It's not a one-stop shop. COVID situation right now is our pandemic, right? So really forging forward as hard as we can to make sure that people are not spreading this disease any further. So we're doing things like COVID testing our caregivers and also requiring them to wear an N95 or KN95 mask for a minimum of 2 weeks after starting a case with a family. So it may be weird to see somebody with a mask on, but it's for the protection of the caregiver and for the client. And so I couldn't stress it enough that the background check, the physicals, the COVID tests, the PPDs are all extremely, extremely important.
So I'm going to jump in. I'm going to do a little plug because I don't really think that you emphasized that whole COVID portion the way that you should have. I think what Mia should have said is from the very second that COVID hit, I don't think that your company waited a week. I mean, we were trying to place people at the beginning of the pandemic.
Day
And
one.
Mia had a very detailed, a very cautious and organized plan to not only protect the families who her company supports, but also to protect her employees to ensure that the employees can take care of the families. So you kind of you did it in a nice,
I glanced over it.
yeah, you just kind of glossed it, but it really is important to note. So I believe that before quarantining was necessary, if I remember correctly, that you
Yeah.
were requiring your staff to do so if they
Oh,
had,
yeah.
certain places or out of the country. In New Jersey, we have been at the forefront with New York and some of our sister states of this COVID pandemic, but there were certain precautions that your company was taking before it was mandated by the governor. So
I
I
do agree. I do
put
agree.
that out.
Thank you very, very much, Crystal. I feel like I've been doing this in this environment now for years. It doesn't feel like it's only been, 4.5 or 5 months. It feels like it's been so many moons. I feel like I've been doing this forever now. Our job and our company has grown and changed. We have rewritten our actual COVID policy 14 separate times, adding and adding and adding and adding and adding. We're following all the CDC guidelines. I think that it's so important that we do our due diligence to keep people safe, but also our families are doing their due diligence as well. We used to be able to start care for a loved one within 2 hours. And now it does take some time. It doesn't take a long time, but I need a COVID test on the client if they're coming out of a nursing home or a rehab or a hospital. That could take me a few minutes to get if I have a great case manager.
Mhm.
The hospitals are giving me great case managers, so I'm not having a hard time typically getting the COVID negative test. But then, before I put a caregiver into someone's home, I have them tested. So it could take 3 days or 4 days to get somebody to go into place properly with the right fit. So everybody now has to be a little more patient than we ever were before. And the hospitals have been fantastic. So have the nursing homes and the rehabs, releasing people and so on and so forth, because they really do realize that it's not a 1, 2, 3. It's definitely takes a little bit more time to be comfortable with bringing somebody home from wherever they are.
Yeah, COVID has presented challenges that none of us expected.
No, totally.
I mean, the amount of clients initially who were trying to get out of facilities was unprecedented.
No, it's crazy.
Mia and I were on the phone probably a couple of times a day for a few days in a row,
Yeah.
um, trying to get clients out of long-term care facilities and transitioned home, not because the long-term care facility wasn't safe. That wasn't the issue. The issue was that the family felt more comfortable having their loved one at home quarantined with them.
Mm-hmm.
And that presented other benefits because during a time where you couldn't go visit mom, dad, husband, or wife, you
Mm-hmm.
certainly could do that if they were getting care, in the living room or in the bedroom, however you've kind of set up the home. So
Right.
none of us expected this. It is certainly a work in progress, but even with the facilities, you mentioned earlier that there are times where families will hire private caregivers, even though their loved one lives in a facility. Have
Yeah,
you
we
do
really do team up. We team up with facilities, assisted livings. For the most part, it's assisted living. So in assisted livings, we bring people home from rehabs, we bring people home from hospital stays, but we team up with the assisted livings. I believe that some people are better living in an assisted living building where they're socializing and they're around other people and they're able to enjoy the activities there and they're getting the meals that they need. I believe that sometimes that's the right choice for a person. But sometimes people move their loved one into an assisted living, not realizing that 10 years down the road, mom or dad are going to need a little extra help. And that's where we come in. The assisted living, it's not one-on-one personal care. It is like 8 people to one caregiver that's, doing the rounds. So
Mhm.
they have to wait another 5 minutes or 7 minutes to get to the bathroom, and sometimes people don't like to wait. So there's moments in everybody's life, especially when they're living in an assisted living building, where they want that instant gratification. And so that's where the need for a one-on-one companion or caregiver come in place, just so that they get that instant gratification. So sometimes I'm only providing 4 hours a day, 3 days a week for somebody in an assisted living. And then there's the other ones that sometimes I have to provide a live-in caregiver that lives in the room. It's a small space with the client, because that client has declined so much and really needs the tender loving care and the one-on-one attention, and they don't want to have their skin breaking down from going to the bathroom or something like that. So it's very situational, but we do have a really good working partnership with assisted livings. And families have to know that, they put their family into an assisted living. It doesn't mean that that person's never going to need extra help.
Sure. Sure. And we always talk about nursing homes as worst case scenario. In my world, we say that a nursing home is worst case scenario because no one in their right mind wants to voluntarily leave their home and go somewhere that oftentimes feels more like a hospital or healthcare setting than a home. So
Hmm.
assisted living has always been kind of that middle of the road where
Hmm.
people felt like they had a home, but then could also get the care that they needed. And I
Hmm.
think that for a lot of people, the challenge is really paying for it.
Hmm.
So throughout that, oftentimes a question that will come up is, can I afford home care? Can I afford a live-in aid versus a live out? And, maybe all I need is 4 hours or 5 hours each night of care for my mom because I work and, my husband needs a few hours to sleep and he can't,
Hmm.
cover those additional hours. So does
Right.
cost change if I'm getting care at night as opposed to getting care during the day?
Great question. At Seniors in Place, no, it does not change. We don't believe that care should change on nights and weekends. Um, our care is the same rate, whether it's, Monday through Friday, 9 to 5, or if it's after hours of 5 to next morning. We are the same rate the entire time. I will say that if somebody needs hours such as 10 hours a day or more, I would recommend going with a live-in caregiver, just because it's cheaper for the family members. A lot of people think that, or not think, but they just don't know that they have the option of, my mom needs 12 hours a day. Well, maybe your mom actually needs a live-in caregiver. Let's talk about the two options. Let's weigh them out. Let's talk about what the benefit is of either one. Let's have that emotional conversation. It's hard. It's hard to make these decisions.
On that, can you talk about the sleeping aspect? So I know in prior cases when we've talked and we've talked about clients needing a live-in,
Hmm. Hmm.
your first question to me is usually,
Does
do they
the person
need
sleep?
overnight? Yeah, like, when is my nurse going to sleep? So can you just talk about that piece of it?
Yeah, so it's my certified home health aide that we put in place, overseen by our registered nurses. I have the largest bandwidth of all home care in the state of New Jersey, private home care by nurse bandwidth. Our nurses are amazing, but I will tell you that the certified home health aide, it's just the legality of it is that the caregiver needs to sleep at night. So it's 5 consecutive hours and 3 broken. So where are they going to sleep? I mean, if someone has a 1-bedroom apartment, we can still provide a live-in caregiver there. It's a pop open bed. They slide it into the corner in the afternoon. They pop it open at night. Our caregivers are able to sleep in the living room as long as the loved one is also sleeping. They could get up a couple times, go to the bathroom at night, not a big deal. But if someone's up all night long wandering, that typically does not lend space for a live-in caregiver. That would probably be an overnight or an hourly person. Um, and depending upon the level of need that the person has, sometimes people, listen, seniors, their days and nights get confused sometimes. And it is a really stressful situation. And until we get that rectified, sometimes they do need overnight care. And then the family comes back in the morning and takes care of them throughout the whole day. Or they're hiring us 24 hours a day until the loved one starts to sleep. But it's really, it's a matter of where is the person going to sleep? How are they going to get their food? And, it's on the family to provide food for a live-in. So, and it's not expensive. It's literally probably between $50 and $70 a week to feed somebody for the whole week. So it's not like a tremendous endeavor for them, for anybody.
Got it. It's tough. There's a
That's
lot, there is a lot to caring for loved ones and to the aging process. So we're going to include your contact information somehow.
Thank
Some fancy
you.
person is going to do that. But can you just share the best way to reach you and
Oh, I'd love to.
your website?
Thank you so much. Okay, so my name is Mia, M-I-A. My last name is Kebea, K-E-B-E-A. My website is seniorsinplace.com. I would love to share my website with everybody that's able to see it, just because I'm so proud of how amazing it is. And you get to meet my whole family. Again, there's like a less than 2-minute video on our website that I'm pretty proud of. My phone number is always best to reach me on my cell phone is 908-400-0107. Again, it's 908-400-0107. That's my cell phone number. And my email address is miak@seniorsinplace.com.
Thank you so, so much, Mia. I appreciate you taking the time today. I hope that if
So
anyone has any questions for myself or for Mia, feel free to email either of us or call. You can contact me at porzioplanning.com, and my number is 973-889-4263. Look forward to talking to everyone soon. Mia, thank you so, so, so
Crystal, you are the best.
much.
I just adore you. I adore you. I adore working with you. And thank you so much for having me on today.
Thank you. Thank you. Bye, everybody.
Take care.